Can you live with a perforated septum? Absolutely. But your tolerance of the perforation are going to be dependent on several factors. Number one, the size and the cause of the perforation. If it was caused from a surgery or substance abuse, you may experience more symptoms than a patient who perhaps got a septal perforation from just picking the nose, or potentially from the use of nasal medications such as nasal steroids or decongestants. What's the difference? Well, in the cases of substance abuse or surgery, there's a lot more trauma that's happened, not just to the perforation, but to all the tissues inside the nose, either from the procedure or from the substance abuse, such as cocaine, affecting all the tissues in the nose. What's the difference? Well, in the cases of surgery and substance abuse, you have a decreased ability to kind of bring oxygen and healthy nutrients to the area that would minimize the amount of symptoms that you'd have in the case of a septal perforation caused by surgery or substance abuse. In the case of nose picking or potentially abuse of nasal medication such as Afrin or Flonase, those perforations usually are only caused by a traumatic injury to a small area of the nose. The rest of the tissue inside the nose is relatively healthy and has minimum symptoms. In those two cases, the difference is that patients who have a perforation that's isolated with a generally healthy nose can tolerate their symptoms for much longer and may not even know they have a perforation for a long period of time. Patients who have a perforation from cocaine use or after a rhinoplasty, septoplasty, or sinus surgery may notice symptoms pretty quickly, and they may be very severe. Either one of those cases, I recommend you have an evaluation to know what condition your septum is in and how long you can kind of prolong getting a definitive treatment if that's your choice. If you choose not to have any treatment at all, doing nothing is probably not a reasonable option. You're going to have to manage it medically, meaning using nasal saline to keep the nose irrigated and flushed and free of any crusting or mucus that's building up in the perforation. And then also, you're going to have to provide some form of humidification and moisture so that the nose stays at a nice, moist level and you're not building up a lot of uncomfortable dry air and mucus and crust that can lead to further symptoms such as foul-smelling odors, crusting and bleeding, and just a general sense of nasal obstruction.